Hello, everyone, and welcome to our week where we will be discussing clinical mental health counseling supervision. I know the book talked a bit about administrative supervision, but really for today, we're going to be focusing on the clinical aspects of supervision. So, thinking about supervision, I would like to give you all a comprehensive definition of supervision. If you take a moment to scan this slide, you will see key aspects of supervision are provided. One, supervision is provided by a senior member of a profession. So this is someone who has been practicing counseling for at least 2 years, and this aligns with our code of ethics. And they offer supervision to a junior member of that profession. So you share membership in the profession, and you're receiving supervision as a supervisee from someone who has been a member of the profession for a significant amount of time. Also, supervision is evaluative, meaning that your work is being observed and evaluated, and supervision extends over time. So in your graduate program, you'll have a supervisor across your semesters of practicum and internship. And as you move toward your unrestricted licensure, you will have an CMHC supervise your work across approximately 2 years. The purpose of supervision is to enhance your professional functioning, monitoring the professional counseling services that you offer to clients. And this means that your supervisor is also responsible for your client's welfare and for ensuring that you're doing things like assessing for safety appropriately. Supervisors also act as gatekeepers for counselors who are not engaging in appropriate or ethical ways. Gatekeeping is an incredibly important role as it protects the public and maintains the integrity of the profession by instituting remediation plans or reporting counselors to the licensure board for investigation when needed. This chart breaks down the differences between counseling, clinical supervision, and administrative supervision, specifically related to the purpose of each, the intended outcomes of each, the agendas, and the basic process or modality of this work. So we will be talking more about clinical supervision, this middle column, throughout the rest of this presentation, but I think that it's helpful to have a bit of a chart to show some of the differences and maybe some of the similarities, and we're going to talk a little more in depth about that as well. If you look at this chart right here, Dr. Diane Borders is a phenomenal supervisor in our field. She was really one of the trailblazers in terms of supervision, and she outlined some components of quality and not so quality supervision here. So for good supervision, you will want to find a supervisor that's going to balance support and challenge. So being validating of the work that you're doing, really highlighting your strengths, but then also pushing you to go a bit deeper, to go a bit further so that you are growing and not just staying kind of stagnant in the work that you're doing. Additionally, a good supervisor really does have respect for their supervisee, has faith in their training and their skills, and really honors this. And in doing so, they also will adjust their role, how they show up as a supervisor, to really meet that supervisee's particular needs. This can mean that they will alternate between the roles of maybe a counselor, teacher, and a consultant, and we'll get a bit into that later when we talk about the discrimination model of supervision. Supervisors also possess some of the qualities that are consistent within counselors, so being able to show empathy, being genuine in your engagements, and being open. And this is also open to co-constructing that relationship. They also have a strong foundation in their supervision teachings, so they're able to teach and share necessary information for counselors as they work with clients to not only build the counselor's toolbox, but also to facilitate positive outcomes for clients. Additionally, they're going to be flexible in their supervisory interventions. They are going to be able to gauge what you're needing as a supervisee and embody a different role to be able to meet those needs. This role might shift based on how you're showing up emotionally, cognitively, what kind of skills you're showing up with, and what kind of supervision questions you're bringing into your meetings. Additionally, supervision that is good requires Frequent, accurate, and clear evaluation. So this means evaluation throughout your sessions, within those, and then also between. So maybe you'll have a first session where you talk about your perceived strengths and areas for growth, and that supervisor is going to consistently check in on those and check in on goals to see how you're meeting those. Additionally, there will be formal evaluations like midterms and final evaluations, along with reviewing of your tapes of your counseling sessions. The next bullet point on here of enjoying supervision, I think really speaks loudly, because I know that we all have engaged with people who have really loved their jobs and engaged with people who really have not. For a supervisor to be a quality supervisor, you're going to be able to feel that they really do love supervision, that it's something that fills them up as well. Additionally, they're going to be committed to your growth, and they're going to structure supervision in a way that enhances your growth. Their competence and their experience is going to underground all of this, and it's going to really help you to access your empowerment within that relationship. And then finally, good supervisors are going to have a sense of humor. They're going to be able to laugh with you, because sometimes you need to be able to release in that way. So now to look at the other side, the qualities of a bad supervisor or poor quality supervision. So supervisors who are not sufficiently trained might micromanage supervision. They might leave little room for their supervisees to determine the path of supervision and to determine some of the questions that they really want addressed. Additionally, poor supervision can look like a supervisor trying to actually counsel through the supervisee. So telling the supervisee exactly what to say, exactly what to do, versus allowing the supervisee to figure that out and to put it in their own voice from their own perspective. On the opposite hand of that is supervision that is very hands-off, very kind of laissez-faire. And this type of supervision might result in a supervisee feeling inadequately supported, feeling like they have too much freedom for starting off in counseling without really having an anchor. And so you really want to find a balance as a supervisor between these two. And I think that's what's reflected in this other side of the column here. Additionally, a poor supervisor will not be very invested in a supervisee's work, in a supervisee's goals, and in their achievements. They also might have a mismatch in theoretical orientation or personality styles. And I want to clarify that this can actually be a positive thing if there's fluidity and flexibility around both people's theoretical orientation or personality styles. Now, if they are locked in very firmly and there is no meeting in the middle, or no even trying to take perspective, this is going to be a very poorly matched relationship. And this will also contribute to difficulty building sufficient rapport and trust. If people are not able to meet in the middle and really understand and validate one another, even if they don't share the same theoretical orientation or personality approach, they're not going to be able to have a relationship that is strongly founded enough for a supervisee to feel safe to take risks within their counseling, to grow through stepping into a space of vulnerability and uncertainty, which can be a very powerful and rich learning space. Here I've included some links to a few videos that detail supervision in some maybe tricky supervisee experiences. And so I'll go ahead and post these links on the description portion of this YouTube video so that you have easy access to them. But maybe as you watch these videos, you can pay attention to how the supervisor embodies some of the good or maybe some of the less good qualities that we talked about on the last slide. Now, there are going to be some parallels between counseling and supervision. So let's go ahead and look at some of the ways in which counseling is similar to supervision. So with our clients and with our supervisees, supervisors must review and sign informed consent to be supervised. In this relationship, there are two levels of informed consent. One level between the supervisor and the supervisee, and then the other level between the supervisee and the supervisee's client. As a supervisee, you will sign one informed consent with your supervisor and then inform all clients that you're being supervised and their requirements of supervision. For example, that you will be taping your sessions, that you might do case presentations within a group of other supervisees and your supervisor that are all required to maintain confidentiality just as you are. Additionally, In the supervision relationship, kind of like in counseling relationships, you will set goals. Now, in supervision, this is going to be goals surrounding your competency as a counselor specifically. So there'll be measurable and achievable goals surrounding your development. And this can be measured, like we mentioned before, by evaluations that are more formal, like midterm and final evaluations, but also evaluations through watching your videos. Additionally, you address your personal issues within supervision. However, you address issues as they pertain specifically to your performance as a counselor. If you are experiencing some struggle in your life that is impacting your ability to counsel, your supervisor is going to go into this with you. However, they're not going to be your counselor. They'll likely refer you out to counseling so that you can get that extra support and so that you can more effectively serve your clients. Additionally, there are theories of supervision, just like in counseling, and these will be used as they align with your needs as a supervisee. Furthermore, supervision is a safe space in which the supervisor attends to the supervisee's strengths and addresses supervisee emotions, cognitions, behaviors, and values as they relate to client treatment. So though there are many similarities between counseling and supervision, there are also distinct differences. In counseling, your goals relate to client wellness and growth. In supervision, goals relate directly to counselor clinical competence and clinical growth. Though you will see later in this presentation that sometimes a supervisor might enter into a counselor-like role with a supervisee, this is only for the benefit of the counselor's professional growth. And like I mentioned before, if the counselor needs to do deeper level growth, the supervisor will request that they engage in some external counseling. Additionally, unlike in counseling, communication is not privileged here. Because the supervisors are gatekeepers for counselors in training, supervisee info might be discussed in supervision and with professors who are also part of the department and play that gatekeeping role as well. This leads to the evaluative component of supervision. Supervision is in place to ensure the high-level training of counselors in training. If supervisees demonstrate unethical behavior, resistance to supervision, and clear concerns for ability to maintain client welfare, supervisees will be asked to remediate the problem. If they cannot or will not do so, they may be dismissed from a program or the profession. The strongest supervision models are developmental in nature, meaning that they meet the supervisee where they are, much like we aim to do with our clients. Arising from a developmental framework means that each stage follows in sequence after the previous stage is satisfied. So one stage must be successfully navigated before moving to the next. This leads to pretty significant qualitative changes that build off of one another in complexity and demonstrate growth in the quantity of skills and interventions intentionally used by the supervisee with their clients, as well as the quality of these interventions and related client conceptualization. One developmental model is the discrimination model. This model is defined by 3 roles that the supervisor embodies and 4 main areas of focus. We're going to jump into looking at that role more closely now. So the roles of the clinical supervisor can either be the role of the counselor, the teacher, or the consultant. And these roles are going to be employed differently with intentionality to meet the supervisee where they are. For a counselor role, this would be if something's impacting the counselor's work that might be addressed in a counseling type manner. But there are limits around this. So for example, if a counselor is working with a client who is recently dealing with the loss of a loved one, let's say a parent, you might find that this counselor in their videos starts to kind of dance around this topic. And every time that the client becomes tearful thinking about the loss of their parent, or the client begins to talk about this, maybe the counselor tries to intervene and say, oh, but look at this other parent you have, or look at the friendships you have, trying to distract away from the client experiencing that emotion. A time where a supervisor might go into a counselor role with this supervisee is to explore what might be holding that supervisee back from allowing them to go deeper with this client, or even holding space with this client as they mourn the loss of their parent. Let's say that the counselor slash supervisee has just lost a parent themselves, and they're afraid that if they break down in counseling with this client, that this will maybe feel unprofessional, or they won't be able to control themselves when the client is showing emotion. So the supervisor might go into a counselor role here to hold space for the supervisee to process a bit of that loss. But then that supervisor might recognize this supervisee really could benefit from getting some counseling of their own to enable them to better serve their clients and hold space for grief and loss without being triggered or thrown into their own kind of grief spiral. Another role that the supervisor might embody is that teacher role. And this happens more often in the beginning of supervision, where the supervisor is maybe teaching skills, modeling techniques, doing role plays, things like this. So this is really where that clinical supervisor is being a model for the supervisee. Maybe they're trying out different techniques. Maybe they're trying out different ways to maybe broach topics about cultural differences between the counselor and their client. This can be a really generative stage, but eventually, as the supervisee slash counselor gains more skill and more confidence and competence, the supervisor will start to shift into that consultant role. This is further along in the supervisee's development, and this is where the supervisor and supervisee are more like peers, and they're kind of tossing ideas back and forth between one another. This is still evaluative. So the supervisor is still evaluating the supervisee, but there's more of an understanding of development of where that supervisee is and the level of freedom that they should then have access to. If you look on this slide, this shows the way that those roles of counselor, teacher, and consultant can be used in these areas of focus here. So the areas of focus are counseling performance skills, cognitive counseling skills, self-awareness, and professional behavior and ethical standards. And in the next slides, we're going to break down what these actually mean. But in any of these areas of focus, the supervisor can go into the counselor, teacher, or consultant role. For counseling performance skills, this is more focused on that building of rapport, what you do during counseling. So the skills you use, the interventions you use. So building rapport, using silence appropriately, using self-disclosure appropriately, pacing your session and managing time within session. This also entails exploring counselor responses to client verbal and nonverbal messages, and the use of theory-based techniques and interventions. Additionally, the organization of the session is going to fall under counseling skills, so how the counselor opens and closes the section. And then also something that feels very important to mention in here is that idea of engaging in an effective suicide assessment. So are you, as a counselor, broaching the topic of safety, of past suicidal ideation, present suicidal ideation, and how are you effectively intervening in this? Are you doing a thorough assessment? Are you using a assessment strategy like is path warm? Are you employing necessary questions to really thoroughly assess the client's level of risk or level of safety? These performance skills in counseling are learned through your counseling courses, like your skills and your group courses. Now, as we move into the cognitive skills, this is really the how and what you think about before, during, and after session. These are often referred to as case conceptualization skills, but it's more than that, including how to make decisions in the moment about what to do with your client, how to respond to your client in the moment. And some of these cognitive skills include considerations of the client's background, demographics, and cultural information, the counselor's ability to identify patterns and themes within the client's story, within client behavior, emotion, and cognition, and then the ability to make those decisions about which area that the client's presenting that you want to follow and how you want to do this, and related to that, how you're going to create a comprehensive holistic assessment of the client, as well as a treatment plan. So there are certain pieces of cognitive counseling skills that you learn throughout your counseling program courses as well. For example, you will really heavily focus on this in your theories course, and additionally, you'll gain some specialized knowledge in terms of courses like counseling children, counseling adolescents, sexuality and gender issues in counseling, crisis intervention, and then also addictions issues in counseling. Another area of focus for supervision is self-awareness. And this is really the recognition of personal issues, beliefs, and motivations that might influence your work with a client. This is evidenced by counselor slash supervisee willingness to explore the self. This is something that is highly valued within supervision, that a counselor will be open to engaging with some sticky or some not so comfortable moments. Also, the counselor is going to need to understand any of their reactions to clients and how to use their reactions to effectively work with clients, or how to take space in supervision to process these reactions so they maybe don't interfere in their work with clients. This can link to the imposition of our beliefs and values on clients. How do we process our values and where they might bump up against our clients' values? Well, supervision is a great place to do this, and that's going to allow us to engage more sensitively and more honoring of our clients in their diversity. So the courses that you have learned and discussed self-awareness, it really should be through all of your courses, specifically through skills, through theories, through your multicultural and social justice course, through your gender and sexuality course, and then your professional and ethical issues and counseling course. You're going to have talked a lot about self-awareness, or you will talk about it if you have not yet taken that. And then the final sections here are going to be professional behaviors and then ethical standards. So first we'll talk about the professional behaviors piece. And this is going to be something that you have learned a lot in your counseling skills course, but also your professional orientation and ethics course. So this is everything from being on time to client meetings and to supervision sessions, and also engaging ethically and within legal parameters. So, for example, some professional behaviors that you will discuss in supervision and be expected to maintain are making sure that you're maintaining client confidentiality, uh, completing your paperwork accurately and completely. So, completing paperwork within 24 to 48 hours of finishing a session, not letting weeks pass before you actually record your case notes. Make sure that you're adhering to ethical codes, observing procedures and policies of your location or your placement for internship or practicum, receiving feedback from your supervisors and your peers in supervision. This is an important one because, yes, we can all hear feedback, but receiving it requires that you really take it in, integrate it, and then you apply this. And that's going to be something that's evaluated in your supervision sessions as well. Also, you're going to want to make sure that you're prepared for supervision so that you come with all of your forms, your videos, everything that's required for that session so that it can run smoothly. And then another thing on here is appropriate dress for your setting. So some people might work in adventure settings where you can wear shorts and t-shirts and be outside and active. Others might be in a more formal setting, but you just need to be sure of what is expected of you based on your setting. And this is something that you can talk about in the process of getting onboarded to a site. There are ethical considerations specific to supervision. Your supervisor is going to be under multiple ethical codes. So for ACA, possibly NBCC, and then also ACEs. So this is going to mean that they're balancing a lot of codes, and they're going to always go with the code that is the most conservative code if any ethical concerns arise. And so it might behoove you to look through some of these codes. I know that you've already looked through ACAs and NBCCs, but it could be helpful to check out ACEs so that you're more aware of what supervision requires specifically. Additionally, your supervisors are responsible for your client welfare. So you are directly responsible for client welfare and safety, being their kind of first line of connection. But your supervisors are vicariously liable, meaning that if you are not effectively assessing a client for harm, for risk for suicidal ideation or homicidal ideation, that your supervisor is carrying the weight of that liability as well. So it's going to be very important that you are incredibly transparent and forthcoming with information regarding client welfare in terms of safety, in terms of risk, all of those things that we learn are kind of there's no wiggle room in assessing for these issues, so you want to make sure that you're doing assessments that are very thorough, that are giving you as much information as possible so that you can consult with your supervisor and they can document that they've helped you with your interventions, because they really are going to be the person who's making sure that your client is getting the care that they need through you. So, in terms of assessing for client safety, make sure that you're using models that are shown to be effective for this. Additionally, you might experience that there are some boundary issues that arise with supervision, especially in a counseling program. You might have a supervisor who's in a dual role for you. You might have a supervisor at the university who is your advisor for your coursework, and then also your clinical supervisor at the university level. You might also have a university supervisor who is a teacher in a class that you're taking simultaneously with your internship or practicum. And this is all okay, but this needs to be talked about. It needs to be negotiated and navigated within your supervision meeting so that you're very clear on what your role as supervisee and their role as supervisor looks like in that specific setting. Additionally, your supervisors are also your gatekeepers, so they're going to be the ones that are talking to faculty about your readiness to graduate and go into the field to serve clients. Also, like mentioned before, if your supervisor does go into a more of a counselor role within supervision, they will do this within very specific boundaries, but you will be asked to address some personal issues as they're impacting your clients. Now, the depth to which you address these is going to be negotiated between you and your supervisor, but ethically, they will refer you out to counseling, like I've said before, and it will be your responsibility to access this counseling so that you're doing the work you need internally to best serve your clients when you're sitting in those sessions with them. Also, your supervisor will review informed consent with you. I know I mentioned this earlier that they go over informed consent with you just as you do with your clients, so there's multiple layers of that. You will inform your clients that you're being supervised by your supervisor. You'll give them all of your supervisor's information, and then your supervisor will have a totally different informed consent that they go over with you. And so have included my informed consent on the module for this week. Uh, this is a combination of informed consent and the professional disclosure statement. So if you would like to review it, you'll see that I address key areas of my education and credentials, my approach to supervision, the risks and benefits to supervision, which is part of that informed consent piece, the mode of evaluation, confidentiality and ethical issues, the way that concerns and complaints can be addressed to different boards. If you as a supervisee have any concern or complaint about me as a supervisor, and that's really important for your safety and protection, just like our clients need access to that information for their safety and protection if they're having any type of concern or struggle with a counselor. And then the contract agreement. So please feel free to visit that in the module and to review it. If you have any questions, I'm happy to address that. Okay, so finally, looking at how we get the most out of supervision. Counselors, as you prepare for supervision, please take time to really explore yourself and your characteristics, like your motivation, your receptivity to feedback, your responsibility, self-awareness, and then also the way that you expect to be respected and the way that you show respect to others. Some ways to engage in this process are to visit page 331 in our book, and box 14.3 has a lot of questions that will address your supervisee openness and potential for creating a successful supervision relationship. This is also a part of your discussion board for the week, so hopefully you'll find some of these questions helpful and you'll really explore inward and try and be transparent in creating that foundation from which you might be able to share these insights with your current or future supervisor. You'll also want to consider the other half of this relationship, your supervisor's characteristics. For example, is your supervisor intentional, flexible, proactive, approachable, skilled, relationship focused? There's an important piece of understanding that you want to make sure that you're aware of the roles and goals within this relationship as well. When you do launch a supervisory relationship, you're going to review the supervision informed consent and contract information, their professional disclosure statements, any questions that you have for the supervisor will have questions for you. And you'll also want to talk about your preferences for supervision and feedback, and then also your goals. You both have the responsibility to ensure that this relationship is a positive and that the working alliance is high. You'll want to consider what type of supervisor will work best for you. For example, do you want someone who shares your theoretical orientation and can help you go deeper into your work through this lens specifically? Or do you want a supervisor who's very different from you in theoretical orientation to complement your skills with alternative suggestions or knowledges? For example, one of my past supervisors was very theoretically different from me, and often I found it incredibly helpful because when I became stuck with a client, his interventions complemented the work that I had been doing and allowed me and the client to get unstuck. So this was a very generative and effective working relationship for both of us, and it broadened my lens as well as his lens for offering insight that might otherwise have been unaccessed. When engaging in supervision, you're going to want to consider categories of skills and goals, take initiative, and then also have a supervision question. This will be critical to the structure and effectiveness of the session. Additionally, be aware of reactions and communication within supervision. You might want to ask for clarification from your supervisor if you're feeling a bit uncertain of what they're asking of you, or if you're feeling like you're not really on the same page. Be transparent. Use self-disclosure here. And as a side note, but a very important consideration, your increased transparency and vulnerability will be key to your growth and supervision. If you find yourself frustrated or resisting an intervention, absolutely share this with your supervisor. But at the same time, try not to shut it or your supervisor down completely. There's a reason they're asking you to follow certain paths of action. And sometimes, just like when our clients show resistance, our resistance can be more about ourselves than the supervisor. And finally, supervision is a continuous process. Just as we ask our clients to work between sessions, we must work between our supervision sessions. In your time between supervision sessions, implement and act on the supervisor feedback and or the plan that you have constructed together. I hope that some of these tips have been helpful in terms of helping you get the most out of supervision, prepping to enter supervision, or maybe you can apply them to the supervisory work that you're already doing. Thank you so much for joining me this week, and I will speak to you next week. Have a good one, everyone.